Thank you very much for giving us the opportunity to speak before such a prestigious audience. So I'd like to thank the EIF and the ACT Association for inviting us. And I'd like to essentially take this opportunity to give you the point of view of Withings, which is a French company which manufactures different sorts of devices to track your health, from activity trackers to smart scales, smart sleep sensors, wireless blood pressure monitors, and also environmental monitoring cameras. So in essence, I'd like to share three sorts of idea with you. One is, first of all, lay out our vision for mHealth, which, to sum it up, is very much in line with the European Green Paper, but I'll tell you exactly what it means for us in practice. And then probably detail a few of these regulatory evolution that we see with a very optimistic eye to allow for something which concerns today early adopters, and see how basically this can really transform healthcare in the long run. And maybe I'll ask a few questions at the end on the current legislative discussions here at the European Parliament and what we think about them. So why are we so aligned with the European Green Paper? Well, essentially, just a few words about Withings to explain how we see essentially mHealth being a change in paradigm in healthcare. Well, we started about 6 years ago, manufacturing, designing, producing, selling devices intended for the general public to monitor their health. So, and objects that are connected. So, objects that essentially are connected to an application and deliver a service which adapts to how people use them. Everything, all our devices sync to a mobile app. We can see what people are interested in, and we can update the object, we can update the app based on how people use it. Typically, when we released the scale, everyone said it's a scale that tweets. In fact, you can tweet, but what people are really interested in is the evolution of their weight trend. Every time you weight yourself, essentially the info is sent to a mobile app. It's stored on a secured server, and you can check this evolution. Well, we realized, we were ourselves surprised by what we did, that this was what was really interesting to our users, because it allows them, first of all, to change behaviors, to adopt healthier lifestyles, but at the same time, it basically becomes a tool for smart prevention. So that's really the first brick, and I'll talk just a little bit more about it. And then progressively we see this prevention aspect of our devices move on to new applications, such as early detection and increasingly chronic disease management. Now, why is this a change of paradigm? It's because essentially it's not a change that's been brought out by the healthcare system itself. It comes from the consumer electronics. So, I mean, for us, the big show is the Las Vegas CES. So we come from consumer electronics, we come from telecom, yet we have ventured into healthcare, which is something of a paradox, and I think that's what makes the discussion interesting. Because essentially we have not made our devices to suit doctors, we have made them to suit the end user. And I think that's one of the reasons why they're popular and why the market is growing. And it's also one of the reasons why doctors and the healthcare system should be interested, because in a sense it's disruptive and it's massive. So if you compare basically what we mHealth with telecare, well, it's much more massive, because consumers are paying for the devices themselves, and it's not paid by the healthcare system. So it's actually it has a lot more impact. I mean, it's a lot more prevalent. So beyond that, so what do our devices actually do? Well, you can track yourself. I track a number of things. My watch here allows me to track my steps. I see the daily, weekly, monthly evolution on my app. I track my weight. I track my blood pressure. I'm not chronically ill. I'm not a big sportsman, but because it's so easy, basically this practice of self-tracking has been, it basically concerns more and more people. And that's why also it's disruptive. And what is the effect? Well, the objects are connected, so we can actually derive aggregated statistics based on all of this, and some of which are published in our white paper on mHealth, which I have a few copies of. Essentially, we see that the more people track themselves, the more they tend to change their behavior. People that weight themselves the most tend to lose the most weight. So obviously it's a correlation, it's not causation. But at the same time, people who stopped weighting themselves tend to gain weight. So we can send smart alerts to users. So basically we move on. We see that the more people track their steps, the more they walk. We see that the more they share their steps data with other people, you have leaderboard functionalities, the more they walk. So basically, if I invite you to my leaderboard, you might actually walk an extra 1,000 steps a day just because you realize that I walk a lot more than you. Now, again, these are tools that we adapt based on the perceived effectiveness as measured by statistics that we compute. And this is how we move from self-quantifying to smart coaching. And for this, our engineers work with behavioral scientists to push the right message at the right time to nudge you into adopting better habits. So that's, I would say, 80% of the reason why people buy our devices. But now, because it's available widely in your retail stores, we tend to have more and more doctors that buy our devices, and this is when the regulatory questions begin, because then people start to ask us whether it's wellness or health data, etc. So, and we have a point of view on that, but just what do we do in terms of early detection? Well, typically we have a telecare system in Norway that uses our scales for chronic heart insufficiency early detection, which was not at all the intent of our device at the beginning. We have a hospital in Toulouse that uses our blood pressure monitor and our scales to monitor diabetes patients at home. And we have thousands of, maybe hundreds, I'd say, of such examples, mostly driven by hospitals for chronic disease. I mean, I could talk about the usage of our devices for post-bariatric intervention, follow-up, after basically obesity surgery, etc., etc. If you take most chronic disease, we see hospitals buying our devices to essentially monitor patients at a distance at a cheaper cost compared to traditional telecare systems, because essentially our break-even point is relies on much bigger quantities because we sell to the general public. And now, finally, beyond, I mean, just in terms of our vision, prevention, early detection, and I'll try to go faster. There's one last outcome of what we do is, because we've sold so many devices now, these statistics that I mentioned allow us to move into population health. So we are building now national dashboards where we see the evolution of a country's weight by region with distribution and things like that. So obviously this only reflects our own users, and there might be a bias, but we can measure that bias and we can derive national statistics. So things that, in a sense, we want to use in the best way we can, and this is why we have these discussions with policymakers. So what do we think in terms of regulatory evolutions. Essentially, what we do raises a few questions, and I think we're not against regulation at all, but we need more clarification. So it's more a question of legal uncertainty that I guess slows the transformation of what that slows the application of what we do into the healthcare system. Because we're fine doing this with the consumer in the consumer area, but what we really like to do is have our devices adopted more and more by institutional healthcare players. And for this, there are some legal uncertainties that need to be raised. Basically, the distinction between health and wellness data, which a lot of people are working on, and I haven't seen a clear definition of this anywhere right now. Our point of view on this is that it's the intent that creates the nature of the data. If I just aim to help you coach yourself, it's wellness data. And as the FDA would say, if I pretend that I will cure you, then it's health data. On the other hand, what do you do with like connected electricity counters or connected gas counters? It will help you invoice your customers on their gas consumption. But if you use this data smartly, you'll know how many baths people take. So it becomes health data as well if you start using this data to do population health. So that's one thing, and I'm almost done. The other thing is about securing, obviously, the accuracy of the data. So again, based on the intent, I would say, and about securing the way the data is measured, because our data is accurate from our devices. Typically, our blood pressure monitor gives you the right blood pressure, but it doesn't mean anything to a doctor if a patient takes his blood pressure unless it follows a dedicated protocol. So there's a lack of guidelines to make the patient-generated data acceptable to doctors, because it's not protocolized, basically. So we as developers need to take these guidelines, take this input, to use this data, to make this data usable by doctors. And the fact that and I'll conclude on this, the fact that more and more doctors are using our data, I mean, that's a fact. And one of the reasons, and as evidence to this, you've probably all seen that Apple has released a health app that's native to all iPhones. Google is doing the same. So anyone can track his data. All our devices connect into it. Now, this app in itself is not fantastic, but what they're really doing is they're going to see all the EHR providers in the US or in Europe that have millions of patient-doctor data, and they're making, they've enabled people who can download two apps to share all their data in real time to doctors. So the technology is much faster than the regulatory change, and I hope that our policymakers will adjust soon enough to allow the healthcare system to use all this. Obviously, I have a lot more to say, but in the interest of time, I'll stop here. Thank you very much.